Hey everyone. Today we are starting our next unit on alcohol, tobacco, and substance abuse and addiction. Um, During this presentation, you do have an assignment where it's an opened Google Docs where if I were you, I would open that separately to this so that you can watch this presentation, pause whenever you need to, and fill in the blanks as we go. Little hint, anything underlined in this presentation is something that you might want to look for in your fill in the blank. So here we go. So alcohol, short-term effects to alcohol. It depends on the amount of alcohol consumed, how much somebody drank, a person's gender or size, and whether or not there's food in that person's stomach. The brain will slow the work of the CNS, and later you're going to realize that stands for the central nervous system, which is right here, your brain. Alcohol also dulls memory, concentration. It affects decision making and disorganizes someone's thought processes. The liver. The liver changes alcohol into water and carbon dioxide, which that whole thing is called oxidation. A person becomes intoxicated when they're drinking faster than the liver is able to do that process. So when someone drinks faster than the liver is able to oxidize the alcohol, that's when somebody feels drunk. Blood vessels dilate or they widen, resulting in an increased blood flow, especially to the skin, which makes somebody feel warm or flushed. And that feeling is actually artificial. It's not true. So when someone feels really warm and it's freezing outside and they go outside without a coat, they feel warm, but technically their body temperature is lower. So that's not safe. Short-term effects continued here. The heart. You have an increased heart rate and blood pressure, increases the risk of heart attacks and strokes. Kidney. Alcohol acts on the pituitary gland, which causes the kidneys to produce more urine. So somebody needs to pee a lot more often when they're drinking, which also causes dehydration. And the stomach, alcohol increases the flow of gastric juices in the stomach lining, which causes irritation and internal bleeding if it's repeated over and over. Here's a normal heart. In this area, you can take a look, compared to a hypertensive heart, which means that there's thickening in the walls of the ventricles of the heart. Long-term effects of alcohol. Brain damage. Even moderate drinking can destroy brain cells. It can be a loss of intellectual abilities, memory problems, problem solving, which can interfere with everyday life and functioning. Chronic liver problems. Alcohol interferes with the liver's ability to break down fats, causing the liver to not function correctly. Few things that can happen here with the liver is cirrhosis. Liver tissue is destroyed and replaced with scar tissue. Alcoholic hepatitis, inflammation or an infection of the liver causing weakness, jaundice, which is like that yellowing look, fever, and death. And fatty liver, an excessive accumulation of fat inside the liver cells, which is the most common alcohol-induced liver disorder. So if you look over here, the darker coloring indicates a depressed brain activity, so the blue, and in a normal brain here. So look at the difference between the blue. Alcohol and pregnancy, something called fetal alcohol syndrome, which is a condition where if a woman is pregnant, the fetus has been affected mentally and physically by heavy alcohol abuse. These are the symptoms here, such as low birth weight, impaired speech, cleft palate, slow body growth, heart defects, poor attention span, etc. Driving under the influence. So the effects reduces somebody's ability to judge distances to see how far something away is from us. Speeds, turns, it really just messes up our judgment in every aspect. Reduces our ability to judge capabilities and limitations. Increases somebody's tendency to take more risks. Slows down our reflexes. All these things, not good when you're putting alcohol together with driving, right? Consequences, obviously, right? Death of a driver and or passengers, immediate confiscation of the driver's license. You're going to lose your license right away. Arrest, court appearance, fine, lots of money. suspension of your driver's license, etc. Hard to see here, and if we were in school, we'd probably go over this a little bit more, but you could pause and take a look at some of the DUI laws that happen. All right, moving on to the next part, tobacco, okay? Cigarette smoking affects many body systems, but mainly the circulatory and the respiratory systems. So effects of the respiratory systems. On the right side, pictures of a healthy lung on the left, tobacco smoker's lung on the right. So a few effects on the respiratory system. Chronic bronchitis. So if you've ever had bronchitis before from getting sick, imagine that all the time. That's what chronic bronchitis is. Okay? It is tar from the cigarette smoke, which builds up in the lungs, causing chronic coughing and excessive mucus secretion. Stuff comes up all the time. Emphysema involves the destruction of these tiny little air sacs in your lungs. So a person in an advanced stage can use up to 80% of their energy just to breathe. For us, just to breathe takes about 5% of our energy. Somebody with emphysema, just to breathe, 80%. Imagine having that same person try and walk upstairs, right? So both of these diseases together, chronic bronchitis and emphysema, make up what's called COPD, chronic obstructive pulmonary disease. So if somebody has both of them, they now have COPD. And lung cancer, last one. The cilia in the lungs are destroyed and excess mucus cannot come out anymore. Cancer cells start to form and then they start to spread. Lung cancer is the number one cancer killer for males, which is directly linked to cigarette smoke. Not saying lung cancer can happen from other things, because it can, but it is saying that lung cancer is directly linked to cigarette smoking. Oh, and the picture there, right here on the right, all that black stuff, that's tar. Effects on the circulatory system. If you guys remember, circulatory is your blood flow in your body. Arteriosclerosis, hardening of the arteries caused by plaque buildup, which is caused by the nicotine in cigarettes. Increased risk of heart attack, 3 times greater for smokers than non-smokers. High blood pressure, which can lead to a stroke. So doctors estimate that if Americans stopped smoking, deaths from heart disease would be cut by 1/3, which would save more than 30,000 lives a year. So if you look right here, this is just a normal blood vessel with blood going through. Okay, then with the thickening here of the plaque buildup from arteriosclerosis, right, that yellow stuff, a little harder. Then it gets thicker even more, way more harder. Then it gets to the point where the blood can't even go all the way through, turns around and comes back up. That's like a blood clot. And if that happens anywhere near the brain area, that'll go right back up. And then you can lose blood going to your brain, which is known as a stroke. Gross. Effects of the smokeless tobacco. I was talking about that picture. Leukoplakia, white leathery spots on the lips and inside of the mouth that can develop into cancer of the mouth. Early loss of teeth, bad breath, discolored teeth. These are all the things that can happen on smokeless tobacco. But this can also happen from smoking as well. Smokeless tobacco, if you hear of dip, or the stuff that they put right there inside the mouth and spit. Think about the old baseball players used to do that. Effect on smoke of the non-smokers. We're talking about secondhand smoke here, right? Eye irritation, headache, coughing, more frequent ear infections, and asthma attacks. And believe it or not, lung cancer. At least 3,000 people die each year from lung cancer due to secondhand smoke. So this is from a person who might live with somebody who smokes in the house with them all the time. When I was a little kid, and things were a lot different back then, right? Like when I was little, you could go to a restaurant and the waiter would be like, smoking or non-smoking section, and you'd have different sections. But my mom was a smoker, and she smoked in the house for years. It was probably until late middle school, early high school that I finally got her to go outside to smoke. I have asthma. I've always had asthma ever since I was young. So I wonder if that's connected. I'm sure it is. my mother also smoked cigarettes with me while she was pregnant with me. So that also, I'm sure, has something to do with the fact that I have asthma. And here we go. What I was just talking about. Effects of smoking during pregnancy. Small fetal growth. Babies smaller. I was 5 pounds and born 3 weeks early. Connection? I think so. Increased chance of spontaneous abortion, miscarriage, and prenatal death. Increased stillbirths. That means that a woman has to have pretty much a dead fetus. So they have to deliver a dead fetus. When you get to a point in late pregnancy, if the fetus is dead, sometimes it's not safe, and the woman will have to wait until delivery and and deliver a stillbirth. Growth and development problems during early childhood, intellectual development, and behavioral characteristics. Now, luckily, the only issue that I think I had was, being born early and small and having asthma. All right, moving on. So, substance abuse, substance addiction, we're going to talk about the differences and what all that means. If you can see right up here, licit means legal and illicit means illegal. A drug is a chemical substance that when taken into the body, it alters the function of the body in some way. That is the definition of a drug. Well, so what's the difference? Drug use, misuse, abuse. So drug use, it means for a specific goal, to recover from an illness, taken to go to sleep, taken correctly. Misuse, using prescription or over-the-counter drugs inappropriately. So let's say you weren't given that over-the-counter drug. It was your friend's, so you're using it inappropriately. Or it says to use one and you use two or three. You're using it inappropriately. And then abuse, using for non-medical purposes when it results in physical, mental, or social behavior. So this means you are using a drug that has nothing to do with medical terms. You're not sick, you don't have a headache, you're just using it to have that physical, mental, or social change in your body. Tolerance, dependence, and withdrawal. What does that mean? So tolerance means, so if you're building up a tolerance to something, if you ever heard that before, it means needing to increase the dose to create the same effect. So for example, you need to drink more alcohol now than you did before to get the same feeling that you did before. Dependence, taking a drug to avoid withdrawal symptoms, physical or psychological. So now you're dependent on this drug. You need this drug. You are addicted to this drug because if you don't have this drug, you will start to have these symptoms that could be psychological or physical. You can get really sick if you don't consume this drug. So withdrawal is the body's adverse physical and psychological reaction to the absence of the drug after you built up a tolerance. How drugs enter the body. Different ways. Oral, taken by the mouth. Injection, injected directly into the body, whether it's intravenous, which means through the bloodstream, intramuscular, which means in a muscle, or subcutaneous, which is under the skin. And these are examples of all three. Or inhalation, breathing in toxic fumes. So there's different factors for drug use, okay? There's what's called a predisposing factors, okay? What this means is if you are predisposed, it means it increases the likelihood of somebody beginning a particular behavior. So example, your background, your hereditary, your economic status. If you live in an area where it's all around you and your parents are doing it, drinking, let's say, or all your friends are doing it, doesn't mean you're going to do it. It just means it increases the chances. Enabling factors, things that help facilitate, help make it easier. Drugs are present. They're there. They're cheap. They're accessible. If you live in an area where it's accessible more than another area that is not, that's an enabling factor. And then reinforcing factors encourages the repetition of that behavior. So an example, somebody says, "Hey, you look good," and you lost weight, but you lost weight because somebody was, you know, doing coke or something like that. I don't know. So that's kind of like a reinforcing factor to make maybe somebody continue. A negative example would be quitting smoking, and now you're all around it, all your friends, your coworkers, whoever is doing it, and it's hard to stay, quitting and not continue because it's everywhere. And then, of course, pleasurable experiences from the drug. So the good feeling that they got from the drug would be a reinforcing factor to want to do it again. Psychoactive drugs, drugs that can act on the CNS, brain, to affect mood and behavior. There are 7 major categories, okay? These are just some examples. It doesn't mean that it's all of them, okay? Stimulants, caffeine, depressants, alcohol, narcotics, heroin and cocaine, cannabis, marijuana, hallucinogens, mushrooms or LSD, designer club drugs, MDMA, and inhalants, nicotine. These are just 1 or 2 examples of each. There are more. And you can look at the list here on the left side to take a look at some others as well. So that kind of concludes this like fast break into talking about drugs and alcohol. Please make sure that you have completed your project for the mental health disorder. That project is in the folder of week of 10/5. So it's in the October 5th week folder. Take a look at it. There are many people who have yet to complete it, and many people who haven't even shared anything with me. If you do not complete that project, please remember it's 30 points. That's like 3 different 10-point assignments that you just decide not to do. Make sure you get it done. You had a full week to do it. There's no excuse here. I've had nobody come onto my Zooms to ask me for any questions, so you got to get your stuff done. Have a great day, guys.